Good afternoon, everybody, and welcome to Bird & Kemp's webinar series, Growing with a Spinal Cord Injury. Before we get started, please kindly note that this session is being recorded. Your cameras and mics have been turned off. This is the third session in our webinar series, with our focus today being on mental health and supporting children with spinal cord injury. I'm very grateful today to be joined by Steve Brookes. Steve is a counselling and wellbeing coordinator with the Spinal Injuries Association, and he is also a young person's counsellor with the Moving On project. Steve has also sustained a spinal cord injury. I am therefore very honoured to be joined by him today so he can give us this insight into this very important topic. Thank you, Steve, for joining us. Over to you.
Thank you very much. So yeah, I'm Steve. I'll kind of introduce myself a little bit more later on. I'm here to talk about mental health and supporting children with young people. Little sort of prompt here for the upcoming webinars that BBK are doing, and ones that you might find interesting, and sort of are all in there. So when Rhiannon approached me and asked me to kind of come and talk today, my first question is kind of who's it aimed at? Is it young people with spinal cord injuries? Is it parents or the family members of young people with spinal cord injuries? Young people as parents that have, parents of young people that have spinal cord injuries, healthcare professionals, the legal community, and kind of the answer was it could be anybody. It's all of the above. So what I've tried to do is try to kind of tailor it to kind of incorporate everything. It is being recorded, so you can come back and kind of review what you want and take the information that you need. And I'm quite happy to sort of put my details up at the end. And if you've got any sort of questions, you can either come back to me offline or outside of the webinar. I'm more than happy to kind of help where I can. So what's my interest in working with young people, children and young people? It's basically to do with my current role, the training, the training that I did, my experience of young people, both personal, professional, and kind of in the educational settings I've worked in. And I just generally have an interest in working with young people. I think it's fascinating. So a little bit about me. I'm ex-military. I was in the Royal Navy for about 14 years. And that's kind of when I started working with young people then, as they were kind of later teens, as they joined the military and kind of and progressing into adulthood. That's where I had my injury. I had a motorbike accident. I ended up with a C4, C5 spinal cord injury. I was discharged, and then a couple of years later, I started working for the SCI as their peer support officer, and that's kind of that role's evolved now, and it's a network support coordinator. So when I was working as doing that role, I kind of noticed that there was a real need for sort of mental health support. So my own development as a counsellor, both as children, adolescents, and as adults, has been a bit of a dynamic process. So I went away and initially trained as an adult humanistic and Gestalt counsellor. And I kind of found myself during my placement working at the Moving On project, which was a young person's counselling agency back in 2018. And that was kind of in response to the growing need for practitioners to enter educational settings and school counselling within the UK. It really was kind of really rewarding work, and I really enjoyed it. And as a counsellor, it's kind of the whole point was in response to a government document about transforming children and young people's mental health needs. So and at the time, it was kind of to move away from the traditional services that were delivered by NHS and CAMHS. CAMHS is Children and Adolescent Mental Health Services, and that was kind of delivered by child psychologists. So it was kind of to deal with kind of low-level mental health issues. I then started working with SCI again. I kind of come back to them and working with adults and so I kind of specialise working in spinal cord injury, trauma, young people, relationships, and disabilities. I'm a registered member of the British Association of Counselling Psychotherapists, and I'm a parent as well of two young people, aged 19 and 16, two girls. I'm passionate about ethical and inclusive and informed practice. So that's kind of me. So let's talk about spinal cord injuries. Who, when, and where. Spinal cord injury can happen to anybody. It can happen at any point in their life. And the most common sort of is through illnesses and trauma. Now, spinal cord injury in young people is not that common, to be honest. But the most sort of common causes of spinal cord injury in children and adolescents is motor vehicle crashes, predominantly by seatbelt injuries. And that kind of closely follows up with violence and sports being the most common injuries. So children and young people with spinal cord injuries often face unique challenges that can impact their mental health. The adjustment to living with a spinal cord injury and the potential changes in the mobility and the independence and the impact on the social interactions can all contribute to the emotional and psychological strain. It's crucial to provide comprehensive and tailored support to meet the specific needs of this demographic, addressing not only the physical well-being, but also the mental and emotional resilience. Understanding sort of like the multifaceted nature of mental health in individuals with SCI is essentially fostering what I like to do is a holistic approach to their care and well-being. While most people with spinal cord injury don't have mental health problems, they are commonly experienced, and many people not realise that they're suffering, or the children that might not have the emotional intelligence to navigate or even verbalise some of the feelings that they're having. So the emotional impact on a spinal cord injury is like feeling sad, frightened, confused, worried, angry. These are all emotions that they can be experiencing, and it can be really overwhelming. These can occur immediately following an injury, somebody during rehabilitation, or later as children as they grow, as a result of changes in their physical condition or personal circumstances. Someone with an acquired spinal cord injury may already have some mental health problems, and having a spinal cord injury can make them really worse or can make them come back. So some of the common mental health challenges faced by children and young people with spinal cord injuries. Emotional adjustment. Children and young people with spinal cord injuries may experience emotional challenges, and as they begin to notice that they're different from their peers or adapting to new circumstances, that can include those feelings of sadness, frustration, and uncertainty about the future. Social isolation, limited mobility and accessibility barriers can lead to feelings of isolation among children and young people, and they may struggle to engage in social activities and form those sort of peer group connections, friendships. Depression and anxiety. Coping with the challenges of spinal cord injury can contribute to the developmental of depression and anxiety disorders, especially in young individuals with spinal cord injury, and the most common mental health problems that we would come across. One thing I've kind of missed off here is like the mental health stigma as well. A lot of individuals, especially in this population, face stigma associated with disability, and it can really impact their self-esteem and mental well-being, and overcoming the negative perceptions and biases can be a really significant challenge. So early intervention begins with the identification of mental health challenges, both children and young people and young adults with spinal cord injuries. This involves screening, observation, and open communications with the individuals and their caregivers. And when I'm talking about caregivers, I'm talking about parents as well as anybody, sort of any caring adult that helps them. Professionals need to be vigilant. And when I'm talking about professionals, I'm talking about healthcare professionals, and recognizing the signs of distress and psychological struggles. Once it's identified, a multidisciplinary team should be involved in providing the support. And this can include doctors, consultants, GPs, psychologists, social workers, physiotherapists, occupational therapists, basically any other healthcare professional working together to address the mental health needs of the individual. Each profession brings its unique perspective and a different skill set to create a really comprehensive support plan. So it's that early intervention also involves engaging the community and the family in promoting awareness and understanding of mental health in children and young people with SCI. This will include educational workshops, support groups, outreach programs, to ensure that the individuals are surrounded and supported in an informed community. So I started to think about the impacts of a spinal cord injury. I started to look at medical issues and surgical issues, but then I realised actually next week there's a consultant coming. So I don't want to steal his thunder, so I'm not going to talk on all this sort of stuff. But you can see the really profound sort of medical issues and surgical issues. And this is because of the unexpected nature of spinal cord injury, especially in young people. The families are faced with abrupt, severe, and really general permanent changes in function that is devastating. Although infants, toddlers, and young people may not comprehend the implications of spinal cord injury, they may be troubled by the hospital procedures, the rehab sessions, unfamiliar environments, and the limitations to their functioning. The general approach in caring for young people with spinal cord injury is significantly different compared to that of adults. Paediatric care should really be family-centred because of the central role of parents and the family in the child and adolescent's life. In contrast, teenagers needs to be a more adolescent-based approach, looking at developmental-based anticipatory guidance that are provided for young people. That way, the parents can help prepare for potential complications in transition, such as sexuality and transition into adult. Basically, if they've got that kind of, they've already answered those questions, they've got that knowledge, they can answer those questions or point them in the right direction. So I kind of looked at living issues and kind of psychosocial issues as well. And again, really big subjects, and not really enough time in an hour to kind of discuss all these sort of issues. So, you know, again, there are organisations that kind of deal with the living issues, but they kind of work hand in hand with the psychosocial issues. Psychosocial refers to the process or factors that are both social and psychological in origin. It's a term used to describe the combined influence of psychological factors and the surrounding social environment that an individual's, young person's physical and mental wellness has and their ability to function in these sort of different arenas. A psychosocial approach looks at the individuals within the context of the psychological factors, kind of their thoughts, their emotions, their behaviours, and how they interact with the social environment, so family, culture, and the community. So let's kind of look at that a little bit more. Children and adolescents with spinal cord injury may be affected by stress, grief that the parents may experience. During that acute hospitalisation, the initial rehabilitation, parents will experience, you know, real significant stress related to work absenteeism, financial issues, challenges of meeting the needs of the rest of the family. So parents and family members may feel guilty because they're unable to prevent the spinal cord injury, or perhaps maybe because they were involved in some extent. You know, if it was caused by a road traffic accident, perhaps maybe they were driving the vehicle. Acute hospitalisation and the initial rehabilitation process are really emotionally overwhelming for the majority of young people with SCI and their families, because they have to deal with the initial shock of the spinal cord injury, and then they've got to adjust to the significant burden of care that's going to be ongoing and lifelong. Further stress is related to the need for young patients and parents to kind of learn a great deal about, and a great lot of new information about the care required for SCI. And then in most instances, these young patients and parents will need to learn how to carry out the care. Older children, adolescents, and parents may gain some understanding of the concepts of spinal cord injury, but few will be aware of the multiple ramifications, such as bladder, bowel programs, medications, and the importance of pressure relief. For young people with spinal cord injury and their parents, the initial adjustment is complicated by developmental issues. Infants, toddlers, preschoolers really focus on the present and are really comforted by the family. But at developmental age, like what a teenager's going through, when privacy and sexuality are particularly important, catheterization, bowel programs, bathing performed by hospital staff and parents can be humiliating. Impaired mobility restricts the ability of young children as well with spinal cord injury, and their ability to participate fully in kind of school and community developmentally in an appropriate fashion. So this can impact their education, the psychosocial and vocational development. So let's look at education. Whether they're born with a spinal cord injury or they acquire one as a child or an adolescent, school is a really integral part of the lives of young people with spinal cord injury. They're the main source of socialization for children and adolescents, and in addition to providing the educational experience, are really the major determinants of adult employment, which in turn is a crucial predicator of life satisfaction as an adult with spinal cord injury. The research has shown that it's important that young people who have acquired spinal cord injury return to school as soon as possible after their injury, and ideally they should return to the school that they were at before. The reason for that, because returning to school allows that child and adolescent to re-establish friendships and peer interactions after, you know, a period away in rehabilitation or in hospital. Returning to school can be really traumatic for that young person as well. Also for the fellow students, because they're seeing a real change in their friend that's just come back. So teachers really need to be involved in that sort of transitioning back, and having an in-person patient visit kind of when the school is closed and there's not patients, there's no other students around, and having the kind of an OT kind of accompany them along, so they can point out and work with the teachers and with the school, things that will make it easier for them. Sexuality and fertility. Sexuality issues include sort of sexual development, onset, resumption of menses, sexual performance, and fertility. It should be addressed from a developmental perspective at the time of the initial rehabilitation, and can be reinforced at regular follow-up visits that will be kind of ongoing and lifelong. It should be initiated at the time of injury, irrespective of the child age, even if they're very young, with that conversation be had with the parents, so they can have accurate expectations of future sexuality and fertility issues. School-aged children and adolescents should be provided with, appropriate sexuality information, including stuff about puberty and development, fertility, and sexual function. When children participate, and they do now at younger ages, in sexuality education programs in school, they're going to have questions, and who they're going to come to? They're going to come to the parents. They're going to ask those questions. So parents that are informed, and have information and are able to answer those questions. Adolescents may have specific questions about erection, ejaculation, sexual intercourse, fertility, birth control, and pregnancy. So having a really good understanding of how it affects young people with spinal cord injury can really help them feel more sort of at ease with their peers. Recreation. Rehabilitation of young people with spinal cord injury must integrate play, particularly young, sort of children, and recreation, take into account pre-injury interests and experiences as a child, because play is the kind of primary activity of young children. Play techniques should be incorporated into the rehabilitation program. For older children and adolescents, recreation and play livens up kind of those traditional rehabilitation programs, as well as providing a necessary break from kind of the more routine activities. I'm just kind of thinking back as I'm saying that, my rehabilitation and kind of how full on it was with the physios. And it was really hard and sort of going during that sort of one-on-one time. But outside of that, there was nothing really much to do. And you have to entertain yourself as an adult. So young people must be afforded access to kind of typical age-appropriate activities, sport, television, music, movies. And lastly, the families must be given the information about looking at their local area where they live, community-based leisure time and recreational activities, such as wheelchair sports if they're in a wheelchair, or adaptive sports, so they can participate in them. Impacts faced by those in the community: frustration at the slow progress. What I mean by that is people like with incomplete injuries, they get sort of discharged into the community, discharged out of hospital, and they're given that kind of hope that something might come back, or they may get sensation come back or movement come back. And spinal cord injury takes a long, you're talking 1, 2, 3 years before that can kind of happen. So they get frustrated. They compare themselves to other patients, which is and other people with spinal cord injury, which is a kind of a downside really to kind of peer interactions. Those that are familiar with spinal cord injuries, you can have two people with exactly the same type of injury, but they will present in different ways in terms of functionality, in terms of sensation. And that can be really disheartening if somebody's got the same injury as you, but they seem to have more abilities in terms of sensation or functionality. The reality check of the rehabilitation bubble versus the outside world. Particularly spinal units and hospitals, they're geared up for people with disabilities. Automatic doors, ramped access, well, that's not what it's like on the outside world. So it can be a real sort of eye-opener to kind of that experience, and really highlight things that they're not able to do. And they do feel a void between what their abilities are and the environments that they're in. Now, I was an adult who developed a spinal cord injury. So for me, I had an idea of who I am and where I want to go. But when this kind of happened to me, my sense of self was kind of knocked straight out the window. For a young person, that kind of sense of self hasn't really established itself yet. So this is kind of something that they're going to be experiencing, like this confusion. So reassuring that these feelings of confusion are normal, and are going to be expected as somebody with a spinal cord injury, as a young person especially. So without counselling, what about the strategies for promoting positive mental health with children? Physical activity plays a real vital role in promoting positive mental health, encouraging participation in adaptive sports, recreational activities. Physical therapy can really enhance mood, self-esteem, and overall well-being. Exercise has really been shown to alleviate stress, anxiety, and depression while promoting a sense of accomplishment and resilience. And I understand the difficulty in trying to get a teenager to, I've got 2 girls, like I said, trying to get them to do exercises really can be really difficult, but actually once they start doing it, they really sort of get that team spirit and that sort of sense of achievement when they do it. Encouraging peer support networks and developing disability inclusive kind of recreational programs can really contribute to a feeling of community and support. Creating an environment that's supportive is really essential for promoting sort of good mental well-being, especially in children and young people. This can be achieved by ensuring that they have access to inclusive and accessible spaces, leisure centres where they can socialise, youth clubs, engage in activities, and really feel like a sense of belonging in their kind of their area and where they live. Facilitating opportunities for kind of self-expression and creativity as well can really have a profound impact. Art, music, creative outlets can really provide individuals a means to express their emotions, especially for those that are not younger sort of children that are not able to kind of verbalize it. Can help them process their experience and explore their identity beyond their injury. And these outlets can really empower them to communicate without limitations and really foster that sense of purpose and accomplishment. But what about counselling? What and how can counselling help? So I wanted to leave this on the slide, and forgive me for kind of reading off the slide, but this is, I want to give you kind of this so you can see this, and it's something you can kind of sort of see and read afterwards. So like the stigma and judgments associated with teenage and mental health issues can make it really tough for children to find courage to seek help. And many counsellors will be working in settings where their role is to help troubled young people, but that have developed serious mental health issues, but don't really know much about spinal cord injury. So while they may be in a position to talk to a friend, family member, or a teacher, it's important that they're aware of the availability of a professional help from a sort of a counsellor. Counselling provides the young person with the opportunity to explore their feelings, assisting, and as a counsellor, I want to assist that young person who has not been able to develop sort of successful coping strategies and resources, which is really important function as a counsellor. Here they can kind of open up about the problems without shame or discrimination. And the counsellor is someone that will listen, offer support to a young person who may kind of otherwise feel alone in their world. It can serve to increase a young person's resilience by learning how to better manage their emotional life. So therapeutic work with children and adolescents requires an awareness of the natural progression and the flow of human development, as well as the events which could impede the process. There are several different approaches, and I've kind of put them up here to understanding human development. And it's worth noting that there are real significant differences in the way that we approach and the views of development, and considering how these can be used as a foundation for really effective therapy is helpful. Counsellors and psychologists, we're not immune. We agree and we disagree on which is the best form of psychotherapy and counselling. So we're not immune to that type of conflict. However, the theories and ideas are considered the best aids to kind of understanding an individual child or a young person or a family. And so we kind of approach these, and we'll look at these to kind of look at the best way we can support the family and what will be the most helpful for them in this difficult time. But it is important for all counsellors to be able to recognise the early signs of developmental and mental health problems, and kind of by recognising these signs early, we can, look for specialist appropriate referrals and looking for, for the in-depth sort of psychological support. So kind of looking at some of the ones that I kind of use in my work, and so you can kind of read these as well, is these kind of developmental tasks and psychosocial development. So if you kind of look on the left-hand side, Hagervers was an American psychologist, and he developed his theory on developmental tasks. So a developmental task is a task which is learned at a specific point which makes an achievement of succeeding a task possible. When the timing's right, the ability to learn a particular task will be possible. And this is referred to as what's known as a teachable moment. And that's a phrase that you might have heard before. He kind of coined the phrase. It's important to keep in mind that unless the time is right, learning won't occur. So if you try and do it too early or you push them into it too soon, the child, will complete the correct task at the correct time frame. They'll feel happy and accepted by society. But if they're failing to complete these tasks, it can make the young person or child unhappy or feel out of place in society. So you can see how that kind of developmental task, with somebody with a spinal cord injury, especially if they've acquired one, they're born with a spinal cord injury, they've acquired one at a young age, the difficulty they have in kind of those developmental tasks. I kind of use this in conjunction with Erickson, psychosocial development. Psychosocial, like I said earlier, refers to the process of social and psychological origin. So his theory kind of speaks to the feelings that a person has about themselves and their place in the world, rather than their ability to kind of complete tasks that are dictated by societal norms. Kind of those stages of development focus on how people face certain crises, and that's kind of what he says. Crises are at the core of every person's development. Identity versus confusion, intimacy versus sort of isolation. And kind of going through these crises, a person learns how to interact with themselves and the world around them. So Erickson actually coined the term identity crisis. It was actually Erickson that believed that a person faces a crisis, like I said, at every stage. So as a young teenager, we kind of look at the identity versus confusion stage between the ages of 12 and 18. Kind of the major question that a young person, a teenager, is asking is who am I? And what's important for them at the moment is kind of social relationships. So this stage kind of takes place during adolescent periods. Now he'll argue that teenagers are not moody. They're just trying to figure out their place in the world. Well, I've got two teenager girls, and they are certainly very moody and have stages where they're very moody. But what's happening here is adolescents, they understand their expectations are placed upon them by the parents, by society, but they also know that they have their own needs and their own wants, their own desires, and they're encouraged. And if they're encouraged to pursue that identity, a real strong sense of identity will grow. The conflicts are when adolescents kind of experience sort of conflict, and then they kind of get role confusion about where they sit in the world. So a little bit about anxiety disorders and what is anxiety. Sometimes feelings of anxiety are kind of overwhelming and they can interfere with your ability to function. Everybody has anxious feelings. I get anxious. I mean, I was anxious about talking today, but it's when those anxiety and those symptoms kind of stop you from doing anything. So anxiety can be like constant worries, obsession, urges, which you can't control, intense excessive worry about social situations, panic attacks, or intense feelings of irrational fears of everyday objects or situations. So it's when those sort of symptoms kind of become so overwhelming that they stop you doing the things that you want to, that you want to do or sort of participate in. Some of the symptoms that they may experience, like pounding heart, difficulty breathing, upset stomach, muscle tension, feeling faint or shaky, and with young people that might not necessarily have sensation, they'll be experiencing some sort of emotion, some sort of feeling, but sometimes they can't put their finger on it or are able to kind of say what it is. It's common for people with anxiety disorders to kind of experience depression at the same time. So again, looking at sort of depression, while everyone can feel low from time to time, that's perfectly normal. Depression is an illness, and I mean that it really is an illness, which significantly affects the way you feel. It's that persistent lowering of mood. Depression is often accompanied by another range of physical symptoms, which I'll kind of touch on in a second. But these kind of symptoms affect the way you function from day to day. Mild depression can be treated with medication, ideally alongside talking therapy, but more severe depression may require inpatient treatment because there's a risk of self-harm. And I'm not talking about I'm not just necessarily talking about, sort of self-harmers in terms of cutting, but in terms of not doing their care routines. So it may, amplify things because things kind of get overwhelming. So it's that neglect as well of themselves, especially if their needs of care. Some of the warning signs that you can kind of look out for include persistently feeling sad, tearful, disturbances to sleep patterns, loss of interest and motivation, feeling worthless and guilty, loss of pleasure in activities that were previously enjoyable, changes in their appetite or the weight, physical aches and pains, problems thinking, and really having trouble concentrating. If a young person is experiencing kind of 4 or more of these symptoms over a number of weeks, then you need to be looking at sort of professional help. Suicide, suicidal ideation, suicidal thoughts. Thoughts of the future, school pressures, relationships, and sexuality can sometimes be really overwhelming. And it's important to be able to distinguish between a young person feeling suicidal and actually planning or intending to kind of, act on those feelings. So kind of, how do you have that conversation? If you're concerned about, especially if like a young person is showing signs of depression, well, it's about having the conversation. If possible, choose a good time and a place to have the conversation. At the cinema is not a good idea. In a public place while having a meal is not a good idea. So somewhere where you can both feel calm and you have plenty of time to kind of have this conversation. Tell the young person that what you've noticed, what makes you worried. It shows that you care and that you're able to help. You can also ask how they're going, but be prepared to follow up, because they're going to say good or fine, but be prepared to follow up with a question like, well, how are you really? Ask if they're thinking about suicide. Ask that question directly. Are you having thoughts about this? Yeah, this can feel uncomfortable. It feels uncomfortable now, but a direct question encourages an honest answer. Talking to someone about suicide is not going to make them go out and take their own life or put ideas into their head. If someone's suicidal, they're already having those thoughts. But it gives you the opportunity, it gives them and you the opportunity to say how they're really feeling. And listen, really listen to what they're saying, and listen without judgment. Really can help reduce the shame that they're having about these kind of thoughts. Try to understand what led them to feel this way, what's going on in their life right now. And say things like, acknowledge that it's really tough and that you understand that it's really tough. But don't try and jump in to try and solve the problem or convince them that they shouldn't be kind of having these thoughts. That can be really dismissive. And always, if you're unsure or in any doubt, encourage them to kind of seek professional help. So the positive impacts of counselling: reduce social isolation. Let me try that again. Social isolate. Oh no, I'm not getting it. Social isolation. There we go. Depression, anxiety, and stress for young people with spinal cord injury and their families. It can lead to improved, like I say, physical health and mental health. Help introduce and maintain good mental health and wellbeing strategies, routines in the long term, and it thus reducing the cycle of poor mental health, which can reoccur in the future. Counselling can help improve confidence and mental health, especially with young people with spinal cord injury. As people are able to better manage their condition, they'll feel they have access to a more fulfilled and independent life. And help improve resilience and an outlook for the future, helping those with spinal cord injury and families start to rebuild their lives. So I said resilience, and I kind of, I've heard people, I've said resilience before, and people have said to me, well, what is resilience? So as a counsellor, I'm kind of looking at these areas that, as an individual, the community and the family, and kind of getting an idea of what's happened, before their injury, how they're kind of interacting in their injury. So resilience is the ability to kind of deal with life's changes in a balanced way, kind of not getting overwhelmed by things, being able to kind of bounce back from a difficult event. And a spinal cord injury is certainly a difficult event. So, they're going to have valid reasons to be angry, and that's okay. Counselling gives them the opportunity to express that anger in a more healthy way and externalize it in a more healthy way. Being accepting of their injury, it's something that they can't fix, and again, that's okay. So it gives them hope to kind of about what adult life is going to be like. Why is it important? Why is resilience important? Well, it's the key to managing life's realities and not tipping over into, more severe mental health needs. And it enables a young person to really participate in society and feel part of it and want to relate to it. Okay, so parents and caregivers in supporting mental health. Parents and caregivers play a crucial role in providing the emotional support to children and young people with spinal cord injury. It's important for them to create a safe and nurturing environment where a child or a young person feels understood, accepted, and loved. Supporting children in developing independence and self-esteem, encouraging them to take on new challenges and activities despite their physical limitations, can really significantly contribute to their emotional resilience and kind of that well-being that we're talked about. Parents, caregivers can act as advocates for the children, and they're going to need to, especially for the younger children, ensuring they have access to the necessary resources and opportunities. But the idea is, as when they're young, you're going to advocate for them, but giving them the tools to empower them for the child to express their own needs and desires can have a really positive impact on their own mental health. Parents and caregivers should establish a strong partnership with healthcare providers, those and healthcare professionals, and really talk about that more holistic kind of well-being of the child in kind of all different areas. That type of collaboration can include regular communication with the spinal centres or your GP, feedback on how your child is at that particular time, their emotional state, and kind of that alignment with the strategies we've kind of mentioned so far in supporting their mental health. Oh, what's going on? Oh, I think I jumped ahead. No, I didn't. It's there. Sorry. Okay, so supporting parents of young people affected by spinal cord injury. You kind of look on that left side. Parents may need support for their relationship with the child, kind of understanding that their teenage development, their own emotional needs, including sort of dealing with the spinal cord injury and the trauma with that, dealing with systems, such as hospitals, benefit systems, the government, kind of all that sort of stuff. And you may need to have somebody that advocates for you, because if you're kind of dealing with the trauma of a spinal cord injury, that's another aspect that you're not going to have really the headspace for. So also building the parents' resilience. Family and friends of people with spinal cord injury have a caring role, and so they're often emotionally affected, and they have to make those adjustments. So parents themselves are also at a higher risk of depression. Being a carer for someone with a spinal cord injury doesn't mean taking all the responsibility on your own shoulders. There are support groups and services available to help. And as carers, you should look for the signs of stress in themselves, as well, and a healthcare professional looking for the signs of stress in those parents as well. As a parent, you're going to feel stressed because, this type of injury is lifelong. So it can start to affect your own physical and mental health. So, don't be afraid to seek support for yourself as a parent. On the right-hand side, they're looking at principles for those that have kind of delivering support. So recognizing the ongoing trauma that parents may be experiencing. A couple of key sort of things here, kind of help parents obtain better understanding of spinal cord injury, help parents to understand how their children may respond to the trauma, and responses to parents should be sort of person-centered and trauma-informed. The stigma, it's important for professionals to recognize that parents, may feel uncomfortable in looking for help for themselves because they feel it's their child that's going through this. So, actively listen to what the parents and carers and the family members say, be non-judgmental about it, and be respectful, and ensure that an appropriate response or action is taken, and take into concerns, the things that are being raised by the parents. Recognize that even the parents may sort of experience reduced sort of isolation because all their focus is on their child and the young person. They may start to kind of isolate themselves from their own friend groups and then meet their own needs. So help parents kind of strengthen their relationships, not just only with their children, but with their families and their friends, and consider whether there are any barriers that kind of prevent parents accessing support. Support for parents and young people, be it a child or a young person, having strength-based, outcome-focused approach really helps when working with the family. Explain the process to parents, what will happen in meetings, if you're having these MDT meetings, who's going to be present, what the outcomes are, kind of avoid using jargon. And if you do use acronyms and stuff like that, explain what they mean, and manage sort of parents' expectations in relation to kind of services that they're going to be involved in, like wheelchair services, how long the duration and the kind of length of time they're going to be waiting. The most important thing I think with parents and their support is enable them, enable the parents and empower the parents. It was really good. I actually watched the presentation last week, the webinar last week, where we had the two parents. And if you haven't seen it, go back and look at it. It was actually absolutely fantastic listening to the two parents sort of talk. And the spinal world is a small world, and I think one was based up in Liverpool and one was down in the sort of the southwest. And you know, even though that geographically they're sort of separated, they knew each other. And they were bouncing off each other and they support each other. And I thought, you know, as somebody with the spinal community, that was fantastic to kind of see. And parents they need that, you know, they need to be able to talk and kind of bounce off each other and see how each other's, that reassurance that what they're doing is right. Yeah, it was really good. Okay. So a question for you. Can a young person under the age of 16 access counselling without parental consent? Can a young person under the age of 13 access counselling without parental consent? And I'm kind of straying to your realms here now, Rhiannon and Victoria, kind of the legal sort of side of things. So, and again, I think there's something else in a couple of weeks about that, so I'm not going to delve in too much. But it's not kind of quite simple in terms of case law. As a counsellor, kind of during my initial assessment, I want to get a sense of that young person, and we'll explore further just by checking out, do the parents know? What's it like that they don't know? If they do know, what's that like? And if you don't want them to know, why is that? And what would it be like for them, kind of if they found out by mistake? What I'm referring to here is something called Gillick competence and Fraser guidelines. And what I'm assessing here is whether the child is mature enough to make the decision for themselves whether they can seek treatment. And counselling is a form of treatment. Now, it's case law because Gillick was and the Fraser guidelines refers to a legal case, which looked specifically at doctors should they be able to give sort of like contraceptive advice to under 16-year-olds without parental consent. So the answer is there's no specific age which a young person can access counselling. What we need to do is there's no specific age a young person can access counselling, and you need to have parental consent. Young people under the age of 16 assessed as Gillick competent may receive completely confidential counselling without the parents needing to be informed or giving their consent. Now, the Gillick ruling does kind of say that children and young people should be persuaded, so I will encourage them and ask them, you know, kind of to talk to the parents about it, but they don't have to. An individual counsellor kind of needs to assess with the young person and anyone under the age of 18 whether that kind of young person is mature enough and able to understand the implications of accessing counselling without their parental consent. So accessing mental health resources and services. Professional support. Qualified psychologists, counsellors specialised in spinal cord injuries should be available to sort of deliver therapy. But there's not many of us out there, especially counsellors like me with a spinal cord injury. But it's crucial to ensure that children and young people with injuries have clear access, age-appropriate information about mental health. This information should be available in various formats, and it can be either online, easy-to-read brochures, multimedia resources, and it should be tailored to their specific needs at their relevant ages. Looking at accessible facilities, there are specialised paediatric rehabilitation centres in the UK. I think it's Stoke and Stanmore, that caters specifically for the mental health needs of young people. And these centres offer a wide range of services, including counselling, support groups, and recreational therapy, all tailored to meet the unique needs of young people with spinal cord injury. Peer support networks and peer mentoring and community support networks programs connect children and young people with spinal cord injury to each other and to others who have gone through similar experiences. These connections provide invaluable social and emotional support and empowers individuals to share their experience, offer advice, and foster that sense of belonging we've kind of been talking about. Those community outreach programs, outreach initiatives to raise awareness and provide mental health resources in local communities. That's good if you have a great resource in your local area, but given the geographical challenges, if you live in the northwest and there's a great resource in the southwest, in reality, are you going to be able to use it? Well, actually now sort of telehealth and online support is becoming really sort of accessible and becoming really increasingly important. Sort of, I'm seeing that now in the spinal centre as well, the kind of virtual consultations with mental health professionals and doctors and consultants, remote therapy sessions, remote online support communities can really bridge those gaps for people that are not able to access the service locally. So let's look at that support that's out there. Kind of down the left-hand side of the slide as you're looking at your screen, the children and young people's mental health services offer a range of support, and they're usually delivered and funded by the NHS. You've got mental health support teams in schools and colleges funded by the Department for Education, and obviously NHS-funded services from local mental health organisations, such as charities like the Moving On Project that I'm part of, and other social enterprises. NHS services for young people, you may hear them, and I kind of mentioned them earlier, CAMS, it's Children and Adolescent Mental Health Services. And these services for anyone usually under the age of 18, but you can access some services up to the age of 25. How do you get access to these services? We'll see a GP as soon as possible. As soon as you're concerned about any kind of mental health issue or mental health problem, ask for a longer appointment with a doctor so you've got the time to talk things through, and it gives the doctor the confidence to kind of, make the necessary referral. It's important that you can ask doctors and other members of your treatment team, or rehabilitation team about the concerns that you have, either as a young person or as a parent. And other professionals that are out there, teachers, school nurses, social workers, can all put you in touch with these kind of services. You can refer yourself to local services as well, and you just need to look for sort of children and young people, put CAMS and kind of the county and the town that you live in. It'll put you in contact with your regional sort of centre. Looking on the right-hand side of the slide, you've got the kind of the top four sort of organisations there are kind of SIA, the Spinal Injuries Association. That's who I work for. Their vision is a fulfilled life for everyone affected by spinal cord injury. The purpose being they want to be the expert guiding voice that kind of everyone goes to for life after spinal cord injury. Part of that vision is about the health and the care support for people with spinal cord injury, including the physical and mental health challenges that they face. SIA we do have a counselling service, but at the moment it's not open to people under the age of 18. But it is open to anybody over the age of 18, including parents or anybody affected by spinal cord injury. The reason for that, it's relatively new service, so it's just kind of finding its feet. But we do have support network coordinators that are regionally based, that anybody can have access to. Backup is a mentor. They have a mentoring service. They're kind of another spinal charity, and they have a mentoring service that links spinal cord injured people and families members together to volunteer sort of mentors. This can be really powerful, provided you get linked up with the right kind of mentor. When it doesn't work, is perhaps maybe if somebody with a high level injury is getting paired with a lower level injury. Again, we're talking about that comparison that we kind of mentioned before. Aspire is another national spinal charity. It provides sort of practical help for for people, including access to housing, assisted technology, welfare and benefits advice. And kind of down at the bottom, sort of the bottom right hand corner, these are kind of regional sort of charities as well, sort of spokes, Soul Sanity, Charlie Waller, and kind of Young Minds. Young Minds is kind of the young person's arm of the Mind sort of charity. And what I can do is I can put like, I don't know how you're going to sort of get this out to everyone. I can put this all into like a PDF, and if you want it, it can be emailed out sort of separately, including all sort of like the relative contact details for each of these organisations. So where do schools sit with the support? This document, Keeping Children Safe in Education, this is obviously, this gets updated every year by the government, and it gives the guidance for all schools and colleges, which sets out the legal duties that they must be followed to promote, to safeguard and promote the welfare of children. It sets out how the school staff, the schools themselves and colleges deal with disclosures that a young person may say, and the signs to look out for in relation to kind of safeguarding matters. Now, regarding that question I said about sort of consent before, schools and kind of young people's sort of agencies have kind of taken the approach that if you're in junior school and you're under the age of 13, parental consent must be given, whereas a student that's in secondary school and kind of college, you know, parental consent is not necessary. Kind of just to kind of firm that up for you. So a couple of not case studies, but kind of how, you know, I've worked with young people and how, you know, I've worked with adults as well with spinal cord injury, and some of the sort of things that we use. Art therapy really does transform lives. It's so good. Or art in therapy is provide that creative outlet for children. Despite the challenges posed by the spinal cord injury, you know, individuals can find an outlet for self-expression, emotional healing through art, painting, other creative pursuits, you know, sewing, whatever. It can really be discovered in a powerful way to sort of navigate those really complex emotions and challenge that and channel that kind of inner strength that they've got. Empowerment through sport, participation in any kind of adaptive sports, and on that slide before, you've got Wheel Power, who are kind of based at Stoke Mandeville, are really sort of good at sort of any kind of adaptive sport and pointing people in the right direction. Victory through sport, a young person can really find solace, a sense of accomplishment in sport, and participating in adaptive sport. It can help overcome the initial challenges in kind of adjusting to life with spinal cord injury, and really excelling at sport. And that family support and rehabilitation, a young person's journey sort of dedicated towards mental well-being following a spinal cord injury is marked by the support and guidance, and that of the dedication of parents, doctors, therapists, and counsellors that are kind of all work in this field. That tailored approach helps a spinal cord injured young person navigate those emotional and psychological impacts of the injury, enabling them to rebuild a sense of purpose and hope for the future. I'm aware of the time, so I'm just kind of going to get this last slide in. I was going to talk about a case study, but we just haven't got the time. Okay, so advocacy. Advocacy groups, like organisations like the SCI, Backup, play a really crucial role in improving mental health support for children and young people with spinal cord injuries. They work tirelessly in the background to try and influence policies, raise awareness, and ensure the needs of the population are met by the government and at institutional levels, you know, within the hospitals. Personally, I feel the initiative should focus on securing funding for more dedicated mental health services, especially for young people, and lobbying for kind of that better access to resources. Policy initiatives are really vital in creating that support for the environment for mental health care, and by working with policymakers within government, the NHS, Department of Education, ICBs, if you work with the experts in the field, can really help shape the regulations and the guidelines that safeguard mental well-being for children and young people. and kind of finally that rebuilding those robust community support networks is essential for sustaining sort of mental health initiatives. These networks really do provide platforms for individuals, families, and professionals to collaborate, share experience, and really drive that kind of positive change that we really want to see our young people sort of have. And if you're interested in kind of any of this, just contact me or contact the SIA. You know, we're always looking for people to kind of help with this. So just to kind of close, after exploring to the kind of the challenges and strategies and support systems related to mental health in children and young people, it's evident that the comprehensive approach is really essential. Caring for children and adolescents with spinal cord injury presents several challenges and requires unique programming that kind of incorporates changing and challenging the goals as a child grows. It's that early intervention, the role of the parents and caregivers to access mental health services as and when they need it is crucial to a kind of addressing those unique needs. The key takeaways, hopefully, that you're going to get from today is the importance of that tailored support, the need for advocacy and those kind of policy initiatives I kind of mentioned, and the potential for individuals to overcome the mental health challenges with the right resources and encouragement by healthcare professionals, therapists, teachers, parents, and that understanding through education, like what we're doing today, really will help young people with spinal cord injury and their mental health issues. Ultimately, the goal in caring for young people with spinal cord injury is that they become adults who participate fully in their community and experience that high quality of life. And that's kind of what I want for anybody that comes to me with the spinal cord injury and is experiencing mental health issues. Thank you. And what's next? I think you've got medical considerations with children with spinal cord injury, which is on the 20th of March. I'll be joining.
Great. Thanks so much, Steve. That was excellent. I do have a couple of questions for you. We're not quite out of time. So one of my questions was to do with, you talked about access to counselling and that often requires parental kind of consent. Given the stigma that you talked about that is often associated with counselling, can there sometimes be a conflict between what the parents maybe see as the stigma that's attached to counselling and then obviously the great need that is there for children to have access to that? Do you ever see that barrier or conflict?
Yes, but actually, I think now as a society, mental health is so much more in kind of the public domain, and you know, the way people talk about mental health, young people will kind of access mental health themselves. You know, if the parent is not against, are you kind of saying if the parent's against it? Or doesn't
if the parent's against it and you've got a younger child and they need maybe that consenting process of the parents, can that be a barrier to the access?
I've never personally experienced a parent, you know, if a young person is saying that they want to come to counselling, it's more, I've kind of seen it the other way. The young person feels they don't need counselling, but it's the parent that's kind of bringing them and saying, no, they do need something. But I think that's more because the parent, you know, is experiencing perhaps maybe anger. There's issues going on at home and they don't know how or what to deal with, or how to deal with it, or where the anger's kind of coming from.
Yeah.
So sometimes it's about fostering, sort of having those conversations. I mean, the case study I was going to talk about was kind of covered like 2 sets of counselling, and then in the first kind of sets of first sort of sessions, it was about safety and establishing, you know, that sense of that reliance of developing that awareness of the support network the young person had around them. And then kind of halfway through, you know, the person had a horse riding injury, and halfway through that young person were then kind of thinking about, well, she want to get back on a horse. I was then getting phone calls because she's going home and said, my counsellor said it would be a good idea. And I was like, well, that's not kind of, you know, and I'm not going to talk about in terms of confidentiality, I'm not going to breach what that young person says within the session. But I'll encourage the parents to kind of have the conversation with them outside. I get to see them for like 1 hour a week. You know, there's 168 hours in a week. So, you know, you really have to kind of look at the support network and who's around them as well.
Okay. And my other question, I saw on one of your slides that obviously in relation to depression, only 25%, I think it said, of children have contact with a child mental health service. But and I think someone's commented within the chat that, you know, talking and access to people with the injuries or the peer support services and just nagging professionals to try and get that support is so vitally important, and not to give up at the first hurdle. Would you agree with that?
Absolutely, and that's kind of what I was talking about, and that kind of final slide is about, you know, that advocacy and sort of, you know, sometimes as a parent you're going to have to fight. It shouldn't be that way. It shouldn't be that way. But the services like CAMHS are just so overwhelmed. So then they will only kind of take those kind of severe sort of mental health issues, you know, ones that are perhaps maybe pre-existing, and more serious sort of mental health issues, and that's why, you know, the moving on would kind of take the ones that are not so serious, kind of low level support. But increasingly now we're seeing people with more high level sort of mental health needs as well coming into organizations to deal with.
Great. Well, thank you very much, Steve, once again for joining us today. I know that those listening and those listening to this recording at a later date will just gain invaluable knowledge from your session today. So thank you very much. That brings today's webinar to an end. Please join us next week at 1 p.m. when we will be looking at the medical considerations for children with spinal cord injury. We look forward to seeing you then. Thank you. Bye-bye.